Hello, my name is Brian Largent, and I represent the ArcLight Group. We're a technical support and services provider in Tulsa, Oklahoma. Today I will be talking about data security, the cost of insecure data, and even more specifically, how hackers attempt to compromise your security and steal your data. The two common causes for data breach are intentional and accidental. An accidental data breach might be the delivery of patient information to the wrong patient. For example, a member of your staff places a patient's personal electronic protected health information on a USB thumb drive or compact disc and hands the media to the wrong patient. The second type of data breach is caused by malicious intent, specifically unauthorized and intentional access to protected health information. This type of access could be from unauthorized employees, patients, or external actors like hackers. So what is a hacker? The textbook definition of a hacker is anyone who uses a computer to gain unauthorized access to data. At one time, hackers were mostly highly intelligent kids who poked and prodded at external networks to see what they could find, or at least get away with. Today, the same kids still exist, but the more extreme threat is organized crime and both sanctioned and unsanctioned foreign hacking entities. Almost every nation on Earth controls some form of clandestine hacking group. So what is a hacker's motivation? Organized crime hacking is mostly used for financial gain. Nationally sponsored hacking groups are also interested in financial gain. However, they also use hacking as a weapon to damage their enemies, learn trade secrets, and uncover dirt for political gain. Imagine for a minute that you operate a private mental health facility. 10 years ago, you had a patient who is now running for governor or senator. How many people would like to have information in your system? What is that information worth? What if it was a famous athlete with an injury? What about a paternity test? So what is a medical record worth? Today, the average medical record is selling between 50 cents and $1 per record. That doesn't sound like much. But what if a hacker steals your entire database of patients? How many patients do you have? How many personally identifiable records do you keep for each patient? What is the cost to you if a hacker steals one or more patient records? For a little insight into the cost of hacking breaches, we turn to the Ponemon Research Institute's 2016 Cost of Data Breach Report. Ponemon reported that the average cost per stolen healthcare record is $355. An education record comes in second at $246, and financial records come in at third at $221. This is the cost to you, the healthcare provider, in the form of fines, penalties, and other lost business revenue. So the takeaway from this is that your medical records and the records collected and stored by a healthcare provider can be costly to your organization when found in the wrong hands. For example, if your electronic healthcare system is compromised and 2,000 records are stolen, those 2,000 records would net a hacker between $1,000 and $2,000. The cost for you to clean up that mess after paying penalties, fines, and other losses, well, at $355 per record, the cost to you could be in the upwards of $710,000. So a hacker may only make $2,000 off your stolen records, but it could cost you as much as $710,000. So how does a hacker steal data? For our example, we're going to talk about hackers A, B, and C. Each has their own cybercrime specialty. Hacker A creates hacking software called a kit that he sells to Hacker B. Hacker B uses these kits in conjunction with a network of compromised computers called a botnet. Now, a botnet is just a bunch of both privately and corporately owned computers that the hacker has a degree of control over. We also call these compromised computers. So, the botnet computers can be used to attack both internal and external systems and farm data, among other things. So Hacker B, in turn, pays Hacker C to spread his tools to new computers through phishing emails and other means. He must do this regularly in order to grow and or maintain his botnet, which is the number of computers under his control. So here's a fun fact. Many hackers will write code into their viral control software, or also called Trojan viruses, that removes competing viral control software from compromised systems. This ensures that they maintain full control over the systems. So the takeaway. Hacking is a business, and it is a big business. According to the FBI, in 2017 alone, ransomware infections caused over $5 billion in damages. That's not how much they made, that's how much damages they caused. So what does this tell us about hackers? It tells us that hackers are organized, they're professional, and they're hungry. They take any target of opportunity and exploit it for all it's worth. The size, number of employees, limited amount of locally stored data, having old computer systems do not phase, divert, cause disinterest, or annoy them. Hackers are vultures, and a vulture will eat anything. So are you sufficiently scared? I hope not, because scaring you is not our goal. Our goal is to dispel the myths and apply fixes. So what do you do now? If you haven't done it already, it's time to perform a Hipaa risk assessment. Feel free to give me a call. I'll answer any questions you might have about performing a Hipaa risk assessment. You have my word that there will be no hard sales pitch, just answers to your questions. My name is Brian Largent, and I am with the ArcLight Group headquartered in Tulsa, Oklahoma. That's all I have for today. Stay tuned for our next video. Be coming soon. Thank you and have a great day.